We are back with Cone Health's Executive Medical Director of Pediatric Services. He's answering all your questions about kids and COVID. Now you can get your questions right here to him by texting 336-379-5775. Halloween is this weekend. A lot of parents want to know, is it safe to go trick-or-treating?
It is safe to go trick-or-treating. Have fun. I think that COVID has made it a little bit more interesting and complicated than usual, but I think most people are recommending that it is fine to go trick-or-treating. I think the two things that primarily come up as questions are parties and just trick-or-treating in general. And I think for parties, outdoor is better than indoor, just most things COVID related. You're talking about children who primarily are not obviously immune at this point. So masking is certainly still considered to be probably the best way to protect yourself. And an outdoor party is going to be better than an indoor one because it's much more difficult for a virus to spread when you're outdoors rather than indoors. And as for trick-or-treating, I think people can go trick-or-treating, and some of the same general rules, non-COVID related, apply. You know, you should go with a parent. You should probably wear light clothing so it's easy to be seen. Some would even say have reflectors on your costume. I think someone carrying a flashlight is probably a good idea. In terms of the other trick-or-treating things, some of that's going to be dependent upon what the people who are giving out their candies decide to do. Probably the best way to do that is outdoors instead of at the door. Maybe have your candy or treats available in a basket or a container outside that children can just pick up without having to open the door and in a small cluster and be face to face with someone. And masking, we would certainly recommend that children wear a face mask. So probably the best thing is not to have a secondary mask on, as some costumes have had in the past. Rather wear an outfit, but maybe paint your face, colors if that's what you're into, but wearing a mask over the other mask, you don't want to impede a child's vision. But I think, you know, you do all those things and you probably have a pretty safe experience.
What about the candy itself? Early on, we were all like wiping down our groceries and stuff. Do we have to worry about getting COVID from touching things?
Yeah, great question. COVID is still, we understand that a lot more. And it's mostly passed through aerosol. By that I mean little droplets when we sneeze and cough. It theoretically can be passed from surface, but we do not believe that that is any significant route of passing COVID from one person to another. So you could be very cautious and sanitize your child's hands after they've reached into a communal bucket and gotten candy. But still, that's relatively low risk in terms of particularly passing COVID back and forth. Much greater risk is having a large group of people together. So if you trick or treat, probably keep the group smaller. Again, wear a mask. And those things are going to help prevent catching COVID than just the handling of the candy itself.
Okay, so after Halloween, if the child's starting to not feel so well, how do you know it's time to take them to get a COVID test?
I would say that the rules apply pretty much regardless of whether it was after Halloween or not. And these days, if your child's going to school in person and is exposed to other kids, masked or unmasked, and it varies depending upon the school or the environment. If your child starts to not feel well, the best thing to do these days is to get tested. Most of the rapid tests, if you're sick, are good, and they have a turnaround within minutes of getting the test. Some of the tests, if you go to the hospital, our tests are a little bit more sensitive, but there's usually a 2-day turnaround that the test works a little bit differently. But we would recommend that if your child's sick with just general respiratory or viral symptoms, that they get tested.
We're getting some great questions in about kids and the vaccine. We'll answer those right after the break, including kids and allergies. Should they get the vaccine? That's next.